Do you have knee pain due to arthritis, a meniscus injury, or perhaps both? Sometimes the answer can rely in the strength of the thigh muscles around our knee as well as above and below that area. Stay tuned to the end of the video to see how mobility also affects pain. One of the best defenses that we have against knee joint pain is strengthening the quadriceps or thigh muscles. There's actually a lot of evidence published on this topic. Sounds pretty straightforward, right? Unfortunately, a lot of people that have knee arthritis or meniscus issues, they're already in pain, and by the time they've experienced that pain, they lost a lot of that strength. So they don't have enough strength to tolerate doing those sorts of exercises, and that can create a lot more excessive joint forces at the knee. So if we imagine the femur on top and the tibia on the bottom, those bones coming together as you're standing, the forces of gravity pushing down on the cartilage in between, if we're adding extra weight to that, sometimes people can't tolerate that very well. Now, if we improve the size of the muscle, it disperses the forces around the joint a little bit more, and that muscle is contractile tissue, so it's actually helping offload the forces of gravity every time that we take a step, go down a stair, or squat to the floor to pick something up. So that's how improving that muscle strength can really be helpful for someone that has knee pain in their joint. Unfortunately, like we said before, when someone like that tries to go train and lift weights to improve their strength, it's not always tolerable. And this is where blood flow restriction training can come into play. It allows us to lift lighter loads and make similar strength changes as if we were lifting heavier loads, and make almost as much progress along the way without causing that joint pain. So I want you to go back and watch my video on how blood flow restriction training works if you're not familiar with this. Now, BFR training can help really improve the strength of the quadriceps and the surrounding muscles, but it does take time and it's not easy. It requires a lot of effort to put in, and is something that needs to be guided by someone that specializes in this, because there are a lot of different variables with how much pressure you use, how much weight we're gonna use, what types of exercises we can actually do without pain, and many other factors. So in order to do it appropriately and make sure you're progressing along the way and doing 2 to 3 months of strength training to really see good changes, make sure you're doing this with someone that knows how to appropriately dose it. In addition to using BFR or strengthening someone's muscles around the joint, mobility is really important. If you can't fully straighten your knee when you're walking, or if you can't bend your knee very well when going down steps or squatting to a chair, it's gonna create different forces around your joint that will increase the load on the cartilage inside of that joint. And over time, it's gonna create more and more pain. So if we're just focusing on strength training with someone and we're not restoring their full mobility, we're not looking at the joint above and below the area and making sure that their ankle is moving well, their hip is moving well, and they're able to incorporate those things into day-to-day life, then blood flow restriction training by itself or strength training by itself is not going to be enough or nearly as effective. So if you're looking for help with trying to get back to your everyday life and you've been struggling with arthritis or a meniscus issue, make sure you're reaching out to someone that is able to address all these areas. We actually have a 12-week blood flow restriction training program coming up that includes mobility work along the way and making sure that we're addressing all of these areas. Check out our 12-week program by filling out the form below, or download our free mobility tool to see if you have full mobility in your knees, and if not, some exercises that you can do to address it.